mind and body are absolutely related. And for someone who might be listening to this that isn't familiar with biopsychosocial, it's exactly what it sounds like. It's the way that your anatomy is, your body, the way your mind is, and the way it affects your roles in society. And all of those things play into the experience that someone has when they're going through pain.
Yeah. Yeah. I always tell people like again, just like your pain is always real, these other factors are always real, right? There's the emotional side, the social and environmental context, they're all kind of playing together. And it's hard to say like, this is happening over here, so we know for a fact it's going to affect it. We just have no idea how, right? So it is interesting. Like patients come in, even if they have the same exact diagnosis, the same exact etiology sometimes, and they're having widely different outcomes or experiences because everybody is uniquely different. So especially with patients with chronic pain, it's one of those things that's like, it's part of what makes the job of treating and serving patients in pain so, but it keeps it's a challenge for sure, but in a very good way as a clinician. Like if you want to be at the top of your game, I always tell people like go into a clinic or an organization where you're going to be treating people in chronic pain, because it is going to challenge you as a clinician, both in your clinical reasoning and then like just your emotional intelligence, your ability to connect with people and understand their current situation and context, right?
I think that's really exactly how I got into this sort of field, is that right out after school, you do the things you learn in school and you treat two people with an ankle sprain, and, maybe four get better and one doesn't. And you wonder, well, why did this treatment work so well for those four, but that one person, it just didn't work at all for? And then you start finding out that there are other factors besides just, okay, they had an ankle sprain, they rolled their ankle stepping off a curb, but maybe they had some past experience, maybe they had a family member or a friend who had done a similar problem. Maybe it impacted their ability to play in a championship game, or maybe it impacted their ability to go on vacation with their grandkids, and it somehow affected their life in some way that was more meaningful than just, oh, I rolled my ankle, it hurt, and then it got better.